Experience the butterfly life cycle with Insect Lure's Butterfly Garden. This all-in-one kit lets your child hold the wonder of metamorphosis in the palm of their hand. Head to insectlure.com to try this unforgettable experience. insectlure.com.
Mamas, this is your space. Welcome to the Dare to Ask podcast, episode 8, Back to Basics for Kids' Health.
Kids are going to model the behavior that we show them.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
You have to have the healthy food, a balanced diet. You have to have good sleep schedule. You need to be hand washing. And for heaven's sakes, get outside and take a deep breath of air.
Back to Basics for Kids' Health with nurse practitioner Kaylee Weissop. It's a conversation that it's like sitting down with your best mom friend who's been through it all. She is the one who's going to give you awesome advice about your kids' health. And what I loved about getting a chance to sit down and interview Kaylee is that she is such a straight shooter, getting your kids back to the basics, down to fundamentals of healthy lifestyles. And how she presents that information makes it so tangible, doable, and she's inspiring. Kaylee has known her whole life that she wanted to be a nurse, and her desire to help a family or a child was her motivation after she experienced the traumatic loss of her parents as a girl. So she's had obstacles to get where she is and realizing her dream of becoming a nurse and then surpassing that to become a nurse practitioner. And her heart is really all about kids, and so pediatrics just is the right fit for her. So let's get to it. Kaylee, coffee or tea?
Coffee.
Wine or beer?
Beer.
Girls trip or couples vacay?
Well, that depends if my husband is listening. But probably a girls trip. Yeah.
Where's your favorite place to go for a girls trip?
This is kind of embarrassing, but I really haven't actually been on a girls trip. It's like the idea. I would love to do it.
Yeah.
Life has just been so busy. It's hard to plan out that time.
And make it happen. That kind of like the stars have to align.
It truly does. It truly does. And before I know it, my husband has already planned a vacation for us for a week away, and he is the planner. I am not. So I fall short on that as well.
Let's talk about life a little bit and what led you into medicine. Is this something you always knew that you wanted to get into?
I always wanted to be a nurse. Gosh, it goes back to childhood. The first college I went to, I said I wanted to be in nursing, and they said, I'm sorry, your GPA is not quite where we'd like you to be. However, I was still able to conquer the nursing, and now I feel like I'm at the top of my scope.
Love
as
it.
a nurse practitioner. So it took a little bit longer because I did go the LPN to RN to BSN and then to practitioner, but I really think that gave me a good understanding of each level and respect everybody in the medical field there.
The journey is part of what builds us.
Exactly. And it seemed like through each step, I was either pregnant or breastfeeding or something or other. And
there's always obstacles. Let's go back a little bit further. So you said even as a kid, you knew you wanted to get into nursing. So Kaylee, where did you grow up?
My background, I grew up in Fargo, and I do have a twin sister and older brother. Typical household with 3 kids, always fighting. My parents passed away. My father passed away when I was 2 weeks old from skin cancer, and my mom when I was 12 years old from breast cancer. So from there, my grandparents raised us, and we knew our family was a little different, but we still made it to all the activities, all the school functions, all the things. Yeah.
Because of that background with your parents passing so young, and both from cancers, that had to shape your decision into going into healthcare.
Yes. Yes, it did. Any way that you can help a family, help a child and even understand what's going on in their lives or understanding why something is happening, it's huge. Things have definitely changed from 20 years ago when that happened to me to healthcare now. 20 years ago, counseling and such really wasn't the acceptable thing.
Yeah.
And now it's, you're feeling this, let's get you some help.
Yeah.
And we're really normalizing sharing those feelings and understanding your feeling and knowing it's okay to feel that way.
It is no longer taboo. You went to college. Tell me about that journey. Where did you go?
Yes, I went out to University of Mary in Bismarck. And then I later went on for my nurse practitioner through Maryville out of St. Louis, Missouri. That was pediatric specific. My schooling was all peds.
You lived there?
Nope, stayed here. That was an online program. And then you work with Essentia, you work with Sanford, whomever your home base is, get your clinicals done.
Yeah.
You have to be very prompt with your assignments and keeping your meetings with your advisors and
the discipline is more.
Absolutely.
Anybody can play hooky for an in-person class and it's no big deal. But this is, if I'm going to not do a class today, it's a process.
It was a good experience. Made me actually get more into technology too, which
baptism by fire a little bit.
Exactly. If the printer doesn't sync with my computer, I'm quickly finding somebody that can help me.
Let's go into personal because you're married, you have kids.
So I am married, yes, to Robbie, and we've been married for almost 14 years. He and I were kind of that story. We met in a bar. Can I say that?
People meet in bars.
Yes, people meet in bars. 4 to 6 months later, we are engaged, and a year and a half later, we are married. 4 kids later, and some days we don't know if we're coming or going, seeing straight or what's happening. It's wonderful. Our kids range from 14 to 4. So all the different activities, all the developmental stages between these kids.
Oh, yeah.
We're just upside down some days.
Yes.
But
let's talk about those activities.
Robbie and I, we are certified divers, so we do like to scuba dive. Every year we go on a trip, and that's kind of what our trip is based around.
Yeah.
Is diving. That's really cool. My kids want to do it. It's kind of like, ooh, do we want to do the certification yet? Are they too young? We also snowmobile and snow ski all as a family. We ice fish. We're just always doing something. I think if you live in North Dakota, you have to be able to get along with the weather somehow.
Yes.
And so this is our way to at least get out and embrace the snow. We do all that. Yeah, my oldest, she was a golfer for the first time this summer. And my son, he does competitive soccer. He's kind of your all-around athlete, which is really funny. Dabbles in it all. My little Lennon, she's 7 and just my little Spitfire. She's trying cheerleading.
An about face for her because she really presents as a kid that will do any kind of activity or sport.
Yep.
Not gender specific in that.
Hey. Oh, no.
She likes to ride dirt bikes?
Oh, yeah.
Too.
Oh, yes. Oh, yes. How could I forget dirt biking? Yes, she will be on the dirt bike with her helmet and a dress on with galoshes.
Love it.
And she'll go flying through the mud puddles. Mom, did you see that? Yep, sure did. That dress is ruined.
Yes.
My 4-year-old, he just loves life. He's just joyous. Anything he can get his hands on, he's just tickled.
Would you say that that's your happy place? Family and activities?
Yes. Yep. Robbie and I looked at each other. We're like, this is just the best. We don't have exact plan for the day, but we know that we're having fun. The kids are having fun, and we're wearing them out. Yeah.
There's not a screen in their face, and they should go to bed at a reasonable time because we've completely pooped them out.
Yes, that's the goal always, it seems like.
You guys also lake people.
We are lake people, yes. We've had our cabin now for about a year. It's just a beautiful small lake. Yeah. We love it. You just have to feel blessed. Just nice little retreats and, still teaching our kids those responsibilities along the way. They have daily chores.
Yeah. But one of those responsibilities, too, is expressing one's gratitude, which it is dripping from you and your family. You are just very grateful people. Knowing you a little bit, you're very grateful people, hardworking and family people.
Yes, thank you.
You light up when you talk about your kids and your family, which is awesome. But I realize, too, that it's not just at home.
Yes, I love my career, my job, whatever you want to call it. It's not a job when you go to work and you love what you do and every day is so new. Talk with parents about their child and you can watch them light up, and you can see just how proud every like milestone that their kid goes through, and it's neat.
Outside of the well child, getting that annual update in, just because you then can see the child healthy and doing well and thriving.
It's really neat, especially when you see a child from birth a couple years now, and it's neat to see their development and all of a sudden have that conversation where at 3 we didn't get to have a little conversation, but this year we get to joke and play around and have fun at 4, and that's neat.
Babies day old to 18?
Yep. Through 21, which is neat too. You know, of course, if there's woman problems, you need to go to adult land. But if you're coming in for acne, depression, a couple different things like that, certainly I will see them through 21.
All those ages of vaccinations and, you know, your bumps and bruises, your sniffles, your issues. I assume has got to be the cold and flu season.
Yes, kids are kids and sharing respiratory secretions.
Yeah.
To put it nicely. Yes.
There's still little petri dishes at daycare and at school. Regardless of our preventative care, that's always going to be it. As a parent myself, preventative care. What are the things that we can be doing? Is there anything that you recommend for parents?
You know, really, it's going back to your basics. And it's stuff that your parents would have told you or your grandparents. You have to have the healthy food, you know, a balanced diet. You have to have good sleep schedule. You need to be hand washing. And for heaven's sakes, get outside and take a deep breath of air. Sometimes getting outside and just taking a couple of deep breaths, there's those caveats to those. But oftentimes just taking care of yourself and maintaining your water intake, it's important. It's important. And those kids are going to model the behavior that we show them.
We got to be setting the standard. Always easier said than done.
Today's world, it moves fast.
It does. Importance for everyone, the stepping outside. One of the more recent studies that I had read was morning sunshine being very important, not only for your overall health, but mood. But if there is a break in your day, step outside.
Get outside, yes. Can break them away from their screen time and, you know, make it mindful. What do you hear? What do you see? And have a conversation like, oh, yesterday we could see that neighbor's house. Doing those simple things.
Yeah. So important, not only in their development, but also for you just to experience with your kids. What are the biggest challenges right now in pediatrics?
It seems like it's always trying to find the help for the kids that are needing additional support for mental health. Unfortunately, community resources they're difficult to come by. They're difficult to get an appointment within what we think is a timely manner. In healthcare world, if you get an appointment in 4 months, hey, great job. But when it's us and our family, our loved ones, we want it like yesterday.
Of course. Yeah.
And that's just how we are. We're programmed like that. And the other concerns about if parents are looking into like dietary, those services are very difficult sometimes for pediatrics as well.
Yeah.
And finding somebody that can connect with your child and not make your child feel singled out. You know, when we talk about pediatrics, it's not just a child concern if there is weight. It's a whole family plan.
It does come back to that, especially when we're talking about children and the hard topics of weight. It's not a cut and dry. It's not a black and white.
No, it's not. And if we look at that growth chart and we start tracking a BMI after 2, we're not telling parents or the individual, if old enough, we're not telling them that this is an immediate fix. We are simply giving them those tools to make them a healthier adolescent and then adult and then carrying on those healthy habits on their own. Nothing is an immediate fix.
No. In that chair, in that office, and you're having to bring this up to a parent, what are some of the simple things you can start doing today?
Well, for families that live in apartment buildings, we start with walking up the steps, going down the halls, just making it kind of a family activity, 15 minutes a night, 20 minutes. Sometimes that's attainable for some families and some not, and that's okay. For other people, just simply being mindful about what's taking your time away from that activity. Is it homework? Is it screen time? What is it?
Yeah.
And then really bringing that awareness and setting a goal. if we do 20 minutes of this preferred game, can we get up after that and do like 2 minutes worth of running in place or jumping jacks? Like, and making it fun. We really look to the parents to help out with that and not have them sitting there saying, okay, it's time for you to do your jumping jacks. It's like, oh, no.
You got to hop in on this. I like that, and making it feel very inclusive.
Yes.
I'm assuming dietary, usually with all of us, the ugly truth comes out when you actually have to write down or look at what you've ate all day. Processed food all day long.
Yes.
Where's that vegetable? Where's that piece of fruit?
And it can be so hard, especially in today's day and age with the expense on groceries. Everything is expensive. Even if we can't have fresh, organic produce, the next best thing is the frozen stuff. And then whether it's, scooping out a half a cup of frozen mangoes or peas onto the plate for supper, it's something.
Yeah. It's okay to make even small changes today. Hopefully this is a good reminder for somebody listening. If they're like, oh, I've noticed this, I need to be stepping it up a little bit.
We're guilty of it too. If I make a hot dish, I will really try hard to get that extra scoop of cauliflower rice or something in there. My daughter will likely pick out some of the peas. And I'm going to say, no, you need to have a couple bites, and then there might be some bargaining, but after all, we tried, and it was there. It was presented. So
it was presented. And in pediatrics, I'm interested in what you see on a day-to-day.
Lots of well child visits, and those are so fun. I do enjoy those a lot. We will get kids in with complaints of headaches. If they're on a medication, side effect issues, blood pressure concerns, and fainting. And oftentimes we need to really get a good background history on that. A lot of these things can go 10 different ways. Lots of constipation. That's kind of never ending.
Yeah.
Lots of constipation. Oftentimes in toddlers, doesn't exclude kids that are like 9, 10 before they're adolescent also.
A lot of that can be traced back to dietary.
Yes.
Unfortunately, but true.
Yes. The infants and toddlers, it just takes one bad experience of having a hard poop for them to like, no, I had this feeling one time. I'm shutting that sense off and I'm done. And then we have a problem.
Yeah, it's like a fickle age.
Cause and effect.
We had that experience. We learned from that experience. We found the glory that is the tricks that you can do to help. It's just more preparing them.
Yeah, child-friendly. Really great ways to implement these services if they're not available.
Yeah.
Pooling together and I grab this, I grab that. Let's go do this one. And it's a great asset.
It is.
To Essentia Pediatrics.
To get through all of that. Yeah, we learned a lot of things. And going into, having a child who may be anxious about shots, looking ahead, being able to then share at that appointment, hey, if this is available, if Child Life Services is available, really would like this, or just even giving the heads up to the nurse, like, hey, if you have a buzzy bee, or she really wants to be talked through every single step before you're going to do it.
And the kids that have had Child Life involved in their vaccines or whatever they had in the clinic, typically they're looking forward to them again. So if we have the service, we definitely offer it. Other things that parents can really help with informing their child, hey, this is what's coming up in a couple days. You will probably have to get some vaccines. They're going into kindergarten. You will need these vaccines and start preparing your child at home.
This is a good fast take. I remember when I was a kid, my parents would just surprise that on us, and we had no idea what was happening. And then, you're getting shots today.
Yep. That would be my number one recommendation, just to give your kids a heads up. And they have the questions. Well, does it hurt? What does it feel like? I've had kids ask me, well, what does it feel like? Can you pinch my arm to show me? And I said, well, buddy, it's all very much how you think it feels. So I think it feels like a little mosquito bite, but depending upon their past experience is huge.
Yeah.
Unfortunately, if you saw your older brother being held down on the table,
that might,
or your sister was crying and screaming and kicking behind the exam table and they went out and pulled her back out, that can be pretty traumatic.
Yeah.
We try very hard
not to have that experience. Really, this is one of the reasons why I love going to Essentia, is that team approach, that understanding. I always feel so welcome, and then in turn my kids do, and it's always a good experience. Thank heavens.
Yep.
We were taking all these precautions. Now we're more throwing ourselves into the petri dish that is life.
I still recommend vaccines. I still recommend staying home, of course, if you have a fever or simply if your child is telling you they don't feel good. They don't feel good.
Yeah.
And just like you and I tell patients and parents this all the time, if you and I don't feel good, we're probably thinking twice about going to work. Bring that same consideration to our children. COVID is not gone.
Right.
I've had positives last week. Of course, we have our standard go home, rest, hydrate. I guess my tip for formulas is that don't home mix. That's never a safe option right now. As far as changing formulas too quickly, you can have all the side effects from changing your formula too quickly. We recommend 2 weeks. You trial a formula. Okay. Otherwise, you may see the vomiting. You may see the constipation.
Yeah.
Of course, we just never want the bloody mucousy stools.
Yeah, no,
it always comes back to
be
poop.
Bad. Poop really tells a story.
It really does. And we are so interested in poop.
Yeah. What makes me curious still about the formula thing, during a shortage like that, were you making recommendations for parents to maybe try breastfeeding? If it was an elective choice of just like, I just simply don't want to, and here you have this shortage, is that an option? Were parents maybe making that decision on their own?
Some were looking to donor groups.
Yeah.
Of course, you want to have a reputable donor. We're trying to just give them the tiers of formula. If you're used to this formula, you're likely okay to try this one and even this one, but definitely not going up to this one.
Sure.
Because everything is a tier, and we don't want to completely wash out a kid and try soy formula either, because then we can have some electrolyte imbalances, excuse me. So it was kind of a crapshoot for each situation, really having to get the history from parents and what they're seeing with other formulas. The kiddo has siblings with what was beneficial for them.
Oh, sure. Kind of having to do a historic background almost.
Those were some of the more difficult visits.
And if it were difficult from you and your peers on that professional level to the parents that weren't bothering to pick up the phone and ask their pediatricians, I can only imagine what that trial and error had to look like as well. It can be in the rear view.
Formula can be complicated.
Yes. Is there any practical health tips that you like to share with parents? Because my brain, of course, goes to screens. The fear factor right now is, our little kids having carpal tunnel, our little kids having humps on our backs, cell phone neck or something.
Yep. Oh, yeah. So there's definitely kids that have complaints of sore shoulders, sore necks. And that's not just simply at home. These kids they're given a tablet or some sort of device in school, and that's what most of their schoolwork is on.
Yeah.
So I love that they're getting that technology and getting that exposure. With that, I think we're losing the other side of like the body mechanics side and getting up and stretching, just really taking care of your body.
Yeah.
Like kids are going to get sore too.
Yeah, they might be very resilient, but if it is a repetitive thing over and over and over again, the body breaks down. It just does. Jumping jack breaks or walk around the room, or just because it is true. I mean, that's a fear of mine. My kids at school, at home, they're on these screens and tablets all the time.
Then they get home and they want to be on their screen and then do something that they want to do. So it's a balance. It's always a balance, and trying to figure out and convey that message to your child of all ages and not make it they did something wrong, because they didn't do something wrong. They were given this device to do their homework. And now they want to break.
Yeah.
So
it's just a different, just like you said, something that they're going to enjoy.
Yep.
I always love to ask all of my guests, especially since, it's always women providers that I have, what you do for yourself, a health nugget.
That's a funny question when you have 4 kids.
It really is, because you're like, I don't do any of the practices I know I want to do or I should do.
I do like to exercise every once in a while. I'm a pretty good water drinker, but I like to go for walks. I'm constantly stretching. That's a good thing for me. If I have downtime, it sounds really bad, I'll clean.
Well, if that's your release,
It kind of is my release. It sounds silly, but I get so much more done. And I think there's a little like component of maybe I'm not organized. I don't know, but I make a lot of laps in my house.
Sounds like a full-time working mom of 4.
Yeah. So, going from one bedroom to the next to the laundry room, it's like, oh yeah, but I just have to do this. Oh yeah, I just need to do this. And then before you know it, you have 4,000 steps in just cleaning your house.
Yeah.
Oh boy. Well, that was fun.
Obviously good for your body, but
Yes. I do like taking a bath by myself. No kids, no fingers coming under the door. And I make sure everyone knows you do not come upstairs.
Yeah, this is my time. I need this time.
Yeah.
We all need to have something for ourselves like that. It's putting it into practice is usually the biggest challenge.
Yep.
I keep reminding my husband of this too because we keep getting on to the next, season as our kids grow, having as old as 17 down to 7. Like, just think of what was dominating our time and what our complaints were even 3 years ago. They're very different to today.
Yes.
And that everything really is only a season. And while it's crazy with 4 kids and all of this and your life is just in, like you said earlier, in every single direction, which way are we going? I also am already sad for the future and not having that chaos.
Yes.
Because it's so beautiful chaos to me. In my life, this is like, these are the years.
Yeah. We have that same conversation, and you just need to stop every once in a while and just like listen to what your house sounds like. And it's so neat because, 1 minute the kids are really playing great together and, oh, watch this. And the next minute, my son is doing some sort of wrestling move on my 4-year-old son. And then you hear like, shh, are you okay? Don't tell mom.
Yep.
There's days where it's like, oh my gosh, wow, what did we sign up for? This is crazy, but it's not going to be like that forever. So
no,
we try to really enjoy it and take it all in.
I think you're doing a wonderful job personally and professionally.
Well, thank you.
I'm so excited for people to go and see what it's like, whether you're making a move to Essentia or bringing your kids for a visit with you.
Yes.
Kaylee, you guys are accepting new patients, correct?
Absolutely, we are. Yes. The Lights Plaza, a fresh new space.
Yeah, that is exciting.
Yep.
Always growing and expanding. Essentia just continues to do those really great things in our community. And I'm glad you get a new space. That's fun.
Yes, we're so excited.
Best of luck to you. And thank you so much for coming in today.
Well, thank you for having me.
Kaylee has always given me those vibes that if I were to walk out of that appointment with my child and that specific pediatric nurse practitioner, I would be floating out. I'd have a smile on my face. I'd feel encouraged. I would have affirmation that I'm a good mom, and I'd be inspired to be better. In other words, I think she's got amazing bedside manner. We still have a couple episodes left and a bonus episode yet to happen on this season of the Dare to Ask podcast.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
Businesses need to think beyond today. That's why ADP uses data-driven insights to design HR solutions to help your business find more success tomorrow. HR, time, talent, benefits, payroll. ADP, always designing for people.